Hello everyone, I'm Anas Al Awaidi, and the topic for this session or this lecture is about managing chronic conditions in family medicine within chapter 26 and this chapter is about review of family medicine and outpatient scribing within the Certified Medical Administrative Assistant program by ACMSO. Introduction. Chronic conditions such as diabetes, whether type 1 or type 2, hypertension, asthma, and heart disease, represent some of the most prevalent and demanding challenges in family medicine. These conditions require ongoing management, close monitoring, and continuous patient engagement, making family medicine a pivotal setting for long term care delivery. For patients, chronic conditions impact quality of life, require adherence to treatment plans, and often involve a multidisciplinary approach. For healthcare teams, the burden lies in consistently delivering comprehensive and personalized care while maintaining accuracy across all aspects of documentation and communication. For medical scribes working in family medicine, managing chronic conditions presents a unique opportunity to contribute significantly by ensuring seamless record keeping and communication. The role of the scribe becomes indispensable in this setting as they help physicians or clinicians in general track disease progression, document changes in treatment protocols, and ensure compliance with evidence based guidelines. Chronic conditions demand extensive and recurring follow up visits, which often include monitoring test results, recording detailed histories, coordinating among specialists, and documenting preventive care measures. The scribe serves as the backbone of this process, freeing the physician or the clinician to focus on building a stronger patient doctor or patient clinician relationship or patient provider relationship and delivering a high standard of care. Family medicine is unique because it centers on continuity of care. Patients with chronic conditions frequently transition between different healthcare facilities and providers, necessitating accurate and up to date medical records at every stage. Scribes play a critical role in facilitating this continuity by ensuring that all patient interactions are meticulously recorded. This attention to detail minimizes gaps in information, reduces errors, and helps maintain a cohesive care plan that evolves to meet the patient's changing needs. For example, a diabetic patient's record must include accurate documentation of blood sugar readings, medication adjustments, dietary counseling, and complications observed over time. Each of these details must be accessible and clearly presented to ensure effective care coordination. Additionally, managing chronic conditions involves a proactive approach to care by documenting risk assessments, preventive screenings, and lifestyle modifications discussed during consultations. Scribes support efforts aimed at reducing future healthcare complications. For example, when managing hypertension, records must include diet and exercise recommendations, medication compliance reviews, and feedback from the patient about their home blood pressure monitoring efforts. Such documentation not only improves individual care but also contributes to public health efforts by enabling data collection for research and improving population health management. Key points. Ongoing management of chronic conditions. So, monitoring disease progression. We have chronic conditions necessitate consistent monitoring and adjustment of treatment plans. Medical scribes document key indicators to track disease progression and outcomes, and by recording laboratory results, imaging studies, and clinical assessments over time, scribes provide an accurate history of changes in the patient's condition. As for example, for a patient managing type 2 diabetes, the scribe records HbA1c levels during quarterly visits, along with charting trends in blood sugar logs provided by the patient. These details allow the physician to adjust medication doses or initiate alternative therapies. Patient engagement and education. Patient engagement forms the basis of chronic condition management. Scribes document the counseling provided during consultation, including lifestyle modifications, medication adherence, and disease education. Accurate documentation helps ensure that patients take ownership of their condition while healthcare providers maintain a clear record of care. As for example, when discussing management of hypertension, the physician or the clinician may recommend a DASH diet. The scribe notes these dietary instructions, record any questions from the patient, and logs follow-up plans for reviewing compliance. And here is a summarized diagram summarizing the role of medical scribes in chronic care. Medical scribe documentation on the left, on the right, laboratory results, imaging studies, and clinical assessments. Treatment compliance and adaptation. Chronic conditions often require ongoing evaluation of treatment effectiveness. Scribes document medication lists, dosages, frequency, and any reported side effects. This enables the physician or the clinician to assess adherence and modify treatment plans as needed. As for example, a patient with asthma reports increased exacerbations despite adhering to their inhaler regimen. The scribe documents this information, detailing symptoms, medication usage, and lifestyle changes. These notes guide the physician or the provider toward initiating a new medication protocol or referring to a specialist. And here is a summarized diagram summarizing the treatment evaluation and adaptation uh, process. Coordination of care. Multidisciplinary collaboration. Managing chronic conditions frequently involves collaboration across multiple specialists. Scribes ensure seamless communication by documenting referrals, recommendations, and shared care plans. Coordinated documentation keeps all team members informed and aligned. Example here for a patient with a chronic kidney disease, CKD, a scribe records nephrology consults, monitoring lab results, for example, GFR levels, and noting changes suggested by the specialist. This documentation allows the primary care physician or primary care provider to maintain continuity of care. Standard, Standardizing care plans with guidelines. Scribes play a key role in ensuring adherence to clinical guidelines. By standardizing notes to reflect evidence based practices, scribes help providers maintain compliance and improve patient outcomes. Providers can refer back to these detailed records to verify that care protocols meet established standards. As for example, while managing COPD, the scribe documents the use of the GOLD guidelines to ensure appropriate documentation of inhaler prescriptions, exercise recommendations, and pulmonary function test results. Tracking preventive care. Preventive care often overlaps with the chronic condition management. Scribes document when screenings and immunizations are discussed or completed, ensuring patients receive holistic care that addresses both current conditions and future health risks. Example for a patient with diabetes, the scribe records completion of annual foot and eye exams and keeps track of vaccination records such as flu and pneumococcal vaccines. Comprehensive documentation, creating a central hub of patient history. One of the primary roles of scribes is to develop cohesive and accessible patient records. This involves synthesizing medical histories, tracking progress across visits, and ensuring patients' care continuity by maintaining detailed records. As for example, scribes document the timelines for rheumatoid arthritis, RA management, noting initial diagnosis, joint examination findings, therapeutic trials, and transitions to disease-modifying drugs like methotrexate. Highlighting actionable data, scribes focus on documenting clinically relevant, actionable details for care providers. This means identifying significant changes, prioritizing critical findings, and avoiding excessive clutter in the medical record. As for example, for a patient presenting with poorly controlled hypertension, the scribe emphasizes blood pressure readings outside the target range, therapeutic compliance issues, and any related symptoms like headaches or fatigue. Supporting quality measures, chronic condition management ties directly into quality measures for healthcare institutions. Scribes help ensure metrics like blood pressure control rates or diabetes management outcomes are met by documenting every relevant step of the care plan. As, for example, a patient with cardiovascular disease is prescribed a statin. The scribe documents counseling regarding medication adherence, lipid panel results over time, and compliance with lifestyle recommendations to support institutional care benchmarks. The role of scribes in managing chronic conditions, reducing physician workload or provider workload. Scribes allow physicians or clinicians or the providers in general to devote more time to patient communication and complex decision making by handling detailed documentation tasks. This enhances efficiency and reduces the cognitive burden of providers during patient visits. As, for example, during a follow up appointment, the physician discusses a weight loss plan for a diabetic patient while the scribe captures changes to the treatment plan in real time. Improving continuity of care for chronic conditions, continuous and consistent documentation is essential. Scribes track changes across visits, ensuring that all notes are integrated into a coherent timeline. This minimizes errors and helps maintain a logical flow in the patient's record. Example: a patient with multiple sclerosis presents for regular checkups. The scribes ensures that notes on symptom progression, MRI imaging findings, physical exams, and therapy outcomes are well aligned across multiple entries. Facilitating temporal efficiency, chronic care involves frequent follow-ups and repeated data entry. Scribes streamline visit documentation by maintaining templates for common conditions, preparing for visits in advance, and anticipating physician needs or provider needs. Example: for recurrent appointments addressing chronic migraine, the scribe integrates existing templates to log location and frequently of headaches, efficacy of prophylactic treatments, and any new reports from the patient, supporting billing and coding accuracy. Medical scribes ensure that all documentation supports correct billing claims by, by identifying CPT codes based on documented processes and integrated necessary clinical observations. Scribes help institutions maintain financial and legal compliance. As for example here, during a diabetic checkup, the scribe documents the extent of care provided, including counseling on insulin usage and monitoring A1C results, which supports coding requirements for a high complexity evaluation. Summary tables. Next, we have tables to summarize what we have covered through this lecture. A table on key components of ongoing management. Component description, example, value added, risk of neglect. Components, we have monitoring indicators, symptom documentation, medication review, patient lifestyle inputs, and regular follow-ups. Table on coordination of care across specialties. Specialty documentation focus, example, benefit of continuity of care and challenges. Specialties, we have endocrinology, nephrology, cardiology, pulmonology, and physical therapy. Table on enhancing comprehensive documentation, focus area, documentation requirement, example, importance, common errors. Focus areas, we have sequential histories, relevant exam details, preventive measures, multivisceral cases, and testing synopsis. Table on the scribe's role in chronic disease management, task description, example, impact, challenges. Tasks, we have preparing templates, follow-up synchrony, patient interaction details, time synchronize events, and reporting trends. Table on tools for effective chronic condition management, tool, purpose, example, impact on scribing efficiency and limitation. Tools, we have standardized templates, clinical guidelines, checklists, advanced EHR, electronic health record features, referral integration modules. And next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Which of the following best describes the role of scribes in monitoring chronic conditions? A. Acting as the primary decision makers in care planning. B. Documenting disease progression and patient engagement details. C. Designing individualized treatment protocols for patients, or D, conducting regular diagnostic tests? Definitely the answer is B, as documenting disease progression and patient engagement details, as scribes are responsible for recording indicators such as lab results, symptom changes, and patient adherence to treatment plans. This documentation supports the physician in assessing disease progression and ensures detailed records of engagement for patient care. Question 2, why is it essential to incorporate multidisciplinary inputs into patient documentation for chronic conditions? A, to eliminate the need for specialized physicians. B, to ensure treatments are consistent and collaborative across specialties. C, to replace the use of clinical guidelines for care. Or D, to prioritize one patient physician's recommendations over others. Definitely the answer would be B, as to ensure treatments are consistent and collaborative across specialties. As a chronic condition, management often involves multiple specialties such as cardiology, neurology, and endocrinology. Scribes document recommendations and updates from all providers, ensuring clear interdepartmental communication and holistic patient care. Question 3, what is the primary goal of using standardized templates in documenting chronic conditions? A, to simplify patient interactions and reduce compliance efforts. B, to capture comprehensive details while streamlining workflow. C, to replace real-time input from the provider during visits. Or D, to minimize the need for follow-up appointments. The answer is B, as to capture comprehensive details while streamlining workflow, as standardized templates ensure all necessary fields such as symptom reviews, medication adherence, and updates to care plans are documented systematically. This helps streamline the documentation process while maintaining thoroughness, saving time for both scribes and physicians. Question 4, how does accurate time stamping of medical events benefit chronic disease management? A, it allows healthcare teams to meet patient satisfaction survey deadlines. B, it tracks the onset of a new diagnosis unrelated to chronic conditions. C, it ensures precise timelines of interventions for better care coordination. Or D, it verifies that patients attended all scheduled appointments. The answer is C, as to ensure precise timelines of interventions for better care coordination, as timestamping medical events is critical to creating a clear, organized record of when medications are prescribed, tests contacted, or symptoms updated. This accuracy enables seamless teamwork and legal compliance in patient care. Question 5, what is one key challenge of managing chronic conditions in family medicine for scribes? A, reducing the need for patient follow-ups. B, managing large volumes of data while ensuring documentation accuracy. C, avoiding physician input in documenting treatment compliance. Or D, synthesizing medical data only during initial patient visits. Answer is B, managing large volumes of data while ensuring documentation accuracy, as chronic disease management often involves tracking detailed histories, recent updates, and multidisciplinary care plans. Scribes must process and record this data accurately without omitting clinically relevant details, which can be challenging in busy family practice settings. And here we come to the end of this lecture. Thank you very much and goodbye.